Colorectal cancer is one of the most easy to detect and treat. Now, how does it happen? It is said that it is the fourth major cancer in the human beings. So colorectal cancer can occur without warning, but usually it affects the older age groups, and there are warning signs. The warning signs are that you may have changes in your bowel habits. For instance, you may start to develop a diarrhea or a constipation which you did not have before, and you tend to feel that you have not evacuated yourself fully even though you've been to the toilet. Sometimes you may pass blood. Sometimes there may be associated symptoms like loss of weight or not feeling very well, not being able to eat well, feeling lethargic, feeling tired most of the time, and all these things should caution one to see if they need to get further investigations to see in case they have colorectal cancer. So how do we go about it? Meet your doctor. Any doctor of your choice, preferably a surgeon, would be the right person to examine you, do a digital examination of the bottom end, and then decide whether you need further investigations. Any number of very good investigations are available. We do some blood tests to see if there is any indication that you may have some markers that could indicate that you have colorectal cancer. We can do scans which start from ultrasound scans, which are so easy and cheap, to CT scans, to MRI scans, which are all very commonly available all over the globe today. But the most important investigation is a colonoscopy, which is a way of introducing a long tubular camera at the bottom end and inspecting the entire colon, which sits like a perimeter in our tummy. And the biggest advantage of this colonoscopy is not only can you actually see if there is any problem, you can actually take samples such as the polyp I talked about. If you have a polyp, a sample can be taken from it, or even the entire polyp may be removed, so that if by chance there is cancer, your doctor will be able to take a decision that, oh, the whole polyp has been removed, nothing needs to be done, or a sample says that there is a possibility of a cancer, let us investigate this person further with other modalities and see if we need to treat them. How do you treat them? You treat them by doing surgery, which is the first and foremost weapon against this kind of cancer, because once it is caught early and surgery is done, it may be all. We can even expect a cure. I have seen in my own career patients who had colorectal cancer surgery done 25, 30, 40 years back even, and they are doing well. If the cancer is not limited to the colon and has spread outside the colon, nearby or to distant tissues in the body, it complicates the treatment a little bit, in the sense that you may need to take chemotherapy or medicines to reduce the bulk of the cancer, or you may need to take radiotherapy to reduce the bulk of the cancer, and then probably have surgery to remove the remaining tumor. And some people may actually need to then go back to having more chemotherapy and radiotherapy. But all this is still very much in the realm of a potential cure for most colorectal cancer patients. So the right thing to do, if you have any issues that might make you think that because of your family background or because of your own personal habits or changing lifestyle, you feel that there is a reason to worry about a potential colorectal cancer, seek a doctor, preferably a surgeon or a gastroenterologist, to examine you and let them decide the next course of action, which could be tailor-made, which will have to be tailor-made to suit the situation in which you may find yourself in. I want to end this presentation by saying that in approximately 70 to 80% of the people who come to me with suspicion of colorectal cancer in themselves, the final verdict is no, you do not have a cancer, you have only this or that other problem which is easily manageable. So it's not the end all of everything. It is a very, very eminently treatable disease in today's world, and we are here to help anytime.